Welcome, everyone. My name is Dr. Liana Lianoff. I am the current president and founder of the Global Positive Health Institute, the GPHI, and this is the GPHI podcast where we interview experts from around the world on topics of lifestyle medicine, positive psychology, and how they impact us in terms of health, well-being, and particularly how we use them in healthcare. And so today I'm very excited to welcome Dr. Mechelle Palma, who is the current president of the Philippines College of Lifestyle Medicine. So welcome, Mechelle.
Hi, Liana. Thank you so much for having me here. I'm just so excited to be in your podcast today and talk about lifestyle medicine and positive psychology.
Wonderful. So share with us kind of how you got involved in this area of healthy lifestyles and positive psychology. What really grabbed your attention and when you first got into it?
Oh, Liana, I want to answer that question by giving you a background. I would say that I was exposed to lifestyle interventions since I was 10. My mom had ischemic heart disease and depression at an early age. I don't exactly remember the kind of lifestyle we had back then, but what was clear to me was that there was a sudden paradigm shift at that early age in our lifestyle because my mom can't afford to have a bypass operation. So like we came from Metro Manila. In the US, it's like New York City. And then we moved and tried to live in the country. My parents suddenly imposed a whole food vegan diet. We were exposed to farming. And then as young as 14 years old, I was trained to give health lectures on plant-based cooking and other things for the community. So my mom didn't have the bypass operation, but she was able to arrest her condition. So that's when my parents became so involved in missionary and community work. And that's where I encountered a group of international interns from one of the lifestyle centers in Virginia. And we became one of their host families. And that's when I knew I'm going to be a doctor practicing lifestyle interventions and manage patients using methods to naturally bring back health and well-being. But I was frustrated because I didn't learn anything about it during my medical training. But my parents started to operate a wellness center, and the services were kind of mixed natural remedies, which was fully endorsed to me in 2009. So it was not easy to talk about lifestyle interventions back then. Patients wouldn't disclose to their doctors that they are doing lifestyle or wellness programs because doctors will only say, stop it the moment they know their patients are into something other than what they prescribe. So that time I tried searching if there's an existing initiative from the government advocating wellness or lifestyle intervention, some kind of practices. And I only found the traditional and Alternative Medicine Act in the Philippines. So that supports healthy lifestyle modification as intervention for chronic diseases. And so for a time, I thought, oh yeah, we're not primary care, but alternative care. But it was also in 2009 when a family friend, he's a retired primary care doctor in Texas, he introduced lifestyle medicine to me. So he gave me a printed brochure, initially from the Institute of Lifestyle Medicine, and it talks about the CME programs offered under the Harvard Medical School. I saw Beth Freitas there. And then after a year, he gave me another brochure, this time from the American College of Lifestyle Medicine. And so I've been receiving information, updates, and some really good resources about lifestyle medicine from these two US-based organizations because I subscribe in their emails, email list, And then I started attending lifestyle medicine conferences, culinary medicine trainings, health coaching, initially all under the Harvard Medical School in collaboration with the Institute of Lifestyle Medicine. So Liana, that was overwhelming and information overload every time, but I didn't know how to start practicing it in the Philippines. There was no organization like that of the ACLM or the ILM that I know of. Although I am a member of different organizations who are into wellness and natural remedies supported by the Philippine Department of Health, I thought to myself, lifestyle medicine should be totally different, and it should be in the primary care and not into alternative health care at all. And so All I know is that I am into lifestyle medicine because I needed to break the chain of premature death in my family. We have a strong familial predisposition of ischemic heart disease, stroke, Alzheimer's, and cancer, and it took the lives of my family members prematurely. I was diagnosed myself with Meniere's disease and vertebrovascular atherosclerosis at only age 36. My husband has diabetes and liver disease. So that's when I became so sure that lifestyle medicine should be my specialty. So, Liana, I would say that lifestyle medicine seemed to have a footprint from my childhood, and my parents were my first mentors.
That's an amazing story, because you, from a childhood, you've been fully immersed and experiencing this, the power of a healthy lifestyle, and it's been your whole life, it sounds like, and now you're an amazing leader in this. And I would love to learn more about that, but I also want to learn a little bit and pull out how you see since this is the Global Positive Health Institute, how you see the role of positive psychology in helping us to really promote lifestyle medicine and healthy lifestyles.
Well, I have to be honest that I was one of those who did not initially appreciate the role of positive psychology in implementing lifestyle counseling or programs to patients. So in the first few years of my lifestyle medicine practice, I think I was so stiff and was wearing the expert's hat all the time and never the coach hat. I would specifically prescribe a dietary program, for example, and then let my patients try to follow it as much as they can. I did apply some active listening skills, but nothing much about positive psychology. So I was so sure about that because I would remember asking patients, what's the problem? What brought you here in the center? And that's never a positive psychology approach, Liana, right? So I had that personal reflection about the way I implement lifestyle medicine tools when I saw my patients having a hard time coping with what I wanted them to do, maybe just to please their doctors or their provider. And then I bumped into positive psychology again. And there I realized I have wasted so much time talking, explaining, educating rather than listening, motivating, and, empowering my patients to appreciate every opportunity they have to be happy and regain well-being. Of course, we need to educate them, but we can't just let them listen without motivation at all, right? So I realized I was just using lifestyle medicine tools the way I prescribe drugs and expecting my patients will take them seriously. And so I actually started using positively infused language, like framing my questions in a positive and constructive manner. I refrain from asking what's wrong, which we usually do in our clinic visit. Is not easy, especially in our personal encounters and conversations, but it can be learned, absolutely. But my favorite is reframing failures into learning opportunities. So there's a couple of things. One, most patients would definitely experience lapses and relapses, and they would think they're a failure. And two, in lifestyle medicine, we expect to see this happening all the time. So I think this is where I can see that this positive psychology tool, that this is one that I should be really good at, not only for my patients, but for my personal practices as well. We know that there's no perfect lifestyle, and even as providers, we also have our own share of struggles and lapses. So reframing these failures to opportunities is really, really very helpful. And we can only hone this skill, when we have knowledge and trainings and exposures, in positive psychology. So yeah, we talk about this in lifestyle medicine competencies, but there's so much things to learn when you are into training in lifestyle medicine, and like reframing your lens to positive psychology is totally a different thing. Like we became so technical in utilizing all the tools we have in lifestyle medicine, and we forgot the most important thing in behavior change, and it is really becoming positive in the things that we do. Otherwise, everything will be just a stressor or overwhelming to everyone, not only for patients, but for us as well, providers.
Yes, and you speak about the power of positive psychology and the positive approaches for behavior change, which of course is very fundamental to lifestyle medicine and moving towards healthy lifestyles. But you also really alluded to this connection between happiness and health that's maybe not directly related even to the health behaviors. And so we're learning more about that and sort of being able to help our patients be happy for happiness sake, because happiness is then related physiologically to health. And that's on top of course, the actual health behaviors that we're helping them achieve, like a healthy diet and being physically active and getting the right sleep. And so lately, as I've been thinking about this concept, I've been struggling with that. So my thoughts are evolving around this, that we are operating in lifestyle medicine on a single continuum oftentimes, that we're trying to build habits that take a patient from illness to no illness. And we can do a very patient-centered approach. We can be positive. We can ask them about their strengths, but it's still in service of this goal to get rid of disease. And actually, we should actually be operating on another continuum in addition to that, which is simply around this positive health and positive psychology continuum, where we're helping them get from stress, from trauma, from loneliness, from diseases of despair, to become their best selves, positive health. And that by itself will also impact the other continuum that we're interested in, but it's actually more powerful. And maybe that's where we should be starting. And so maybe when we walk into a patient's room, it's like, start thinking, what does this patient have that I can build on, rather than what does this patient have, like diabetes, that we're going to get rid of?
Yeah, that's really true.
And so along those lines, how are you using this now? Specifically, you alluded a little bit to your own practice. Anything more you can share with our health practitioners about how you're harnessing all of this wonderful science in lifestyle medicine and positive psychology?
Well, for one, I would say that the majority of the members of the Philippine College of Lifestyle Medicine, or anyone deciding to practice lifestyle medicine, have their own personal health reasons. Like me, I'm into lifestyle medicine because lifestyle disease is in my genes and in my familial culture, that I have to take care of that. You see, we're pretty much obliged to enhance our knowledge and skills in lifestyle medicine, because we need to provide these interventions, to use these tools for our patients. And because of this, we're also constantly reminded about our own practices, our food and activity, sleep, our stress, our social connections, our use of risky substance. And this is every time we do counseling, every time we do shared medical appointments, and even speaking engagements like this. And eventually this becomes a second language already. So I always say, once you learned about lifestyle medicine and positive psychology, your life will never be the same again. You can't help but share it to others. And the chances for us choosing healthier options in almost everything we do is far higher than the rest of our colleagues who didn't have exposure and immersion in lifestyle medicine and positive psychology. So I think achieving the best outcomes, both for our own personal practice and clinical work, is just a resonance of our personal practices. I could say that we can be more effective in our clinical work if we have experiential references. Like, we can never relate to our patients' challenges in transitioning from meat-centric plate to a plant-centric plate, for example. If you did experience it yourself, you may hardly help patients transition to a plant-based diet, because you're not even doing it for yourself in the first place. Or it could be so easy for you to tell patients to go vegan because you were born vegan. And I think as a provider, it'll be impossible to resonate the genuine positivity and optimism in our patients if we are naturally pessimistic and we only see what's wrong with the things and people around us. So I think we have to strive to become a better example to our patients and strive to live up to what we preach with genuine passion. So this is where I really thought positive psychology plays a huge role. It's when we change a behavior that we see resistance all the time, and changing our own behavior is also a lifelong process, and that can be overwhelming and can be stressful if we don't do it the right way. So I've seen many unhappy providers and patients who put pressure on themselves or their families because they thought they had to impose the martial law of lifestyle change in the house. We all walk in different phases, and people are very heterogeneous, and we have to understand that as a provider, and implementing positive psychology, focusing on happiness in what you do in all stages of behavior change, I thought is a crucial intervention to achieve the best outcomes that we want for our patients and for our clinical practice as well.
That's well said, Mechelle. And I'd love to get a little personal if you would like to share your favorite ways of boosting your happiness, boosting your health. How do you do it at home and with your family, etc.?
Well, basically, one of my favorite is the positive journaling, and I do that every single day. And I can't think of something else that I can do personally on my own, because no one's talking to me about positive psychology unless I would sit, for someone to see me. And it's the personal journaling and putting all the things that I am thankful for that specific 24 hours of the day will really help me get a good kick for another day. So Liana, I always tell this to my patients: you practice 24-hour recall in everything, not only the food recall, not just recalling what you ate for the past 24 hours, but also for physical activity. Oh, I've been so inactive for the past 24 hours. And then, so your social connections, were you isolated for the day? And so the stress, it's not only you stressing here, it can be also you as a stressor to people. Am I a stressor to someone today? Or am I so stressed today? And so this gratitude journaling, positive journaling for 24 hours is also one thing I always prescribe patients, and I always teach our lifestyle medicine providers, because like I said, when you are into lifestyle medicine, it will always be information overload. Like, you want to be so right, in doing things for my patients, and it can be overwhelming. But being positive and journaling positively what has changed with your patient yesterday, it's some kind of motivating you somehow, even if you're not aware, and this is subconsciously motivating you somewhere.
Yeah. It's has to be, like you said, it's an awareness 24/7 and fully immerse, full immersion for ourselves. And a key to that immersion, I think that you were kind of referring to there, is that attention, the attention to what's happening and what we're doing. And in positive psychology, we like to shift attention as much as possible to the positive. That boosts us up and gives us the energy and empowers us to do all the things that we need to do and to tackle difficulties in life.
That's true. That's true.
And so you and I are part of a relatively small group of health professionals globally who are working very hard to pull together healthy lifestyles, positive psychology, all these elements for a total healthy lifestyle that boosts our happiness and health. And we have a vision that we're going after. And that vision, though, may vary from place to place around the world. And you're joining us from the Philippines. So share a little bit about your vision of the future when you're successful with really getting healthcare to harness lifestyle medicine, to harness positive psychology. What's that look like? What is your future driver of that end goal?
I really like that question, Leanna. I'm a daydreamer, and like any other pioneer in lifestyle medicine practice, I think we are one envisioning lifestyle medicine embedded in health education and primary health care, which means people will have equal opportunity to take advantage of lifestyle medicine education and interventions, for prevention and maintaining well-being, and of course, as baseline treatment for chronic conditions. In the Philippines, we are particularly working on the integration of lifestyle medicine in primary, intermediate, and secondary school education. And we're looking forward to a productive collaboration with the Department of Education. We also started that vision, with the initiative of integrating nutrition-sensitive agriculture programs. And this is in collaboration with the Philippine Department of Agriculture, particularly the Agricultural Training Institute, because they provide the trainings for free. They fund what we do, for their beneficiaries. And this is where we integrate healthy lifestyle and culinary medicine curriculum in the training programs provided by the agency to their beneficiaries. So this is not only penetrating the healthcare system, you know what I mean? And we envision in enculturation of healthy behaviors in younger age groups, because we know that I think it would be easier to introduce self-care, healthy lifestyle, happiness, and well-being when people have a good foundational knowledge and experience to begin with. Like I've mentioned to you earlier, lifestyle medicine seemed to have a footprint in my childhood, and it wasn't hard, anymore to talk about this and tackle things in lifestyle medicine. So I believe that will be the same, and we have pilot programs on this already, and that's how we see it, spreading all around. And, not only in the healthcare system, but basic, health education for everyone.
Wonderful. So we were keeping these podcasts pretty short, so we're wrapping up a little bit. And before we wrap up, I have a couple more questions. One is, what are some of your favorite resources that you recommend for healthcare colleagues and resources you recommend for patients?
Well, like any existing lifestyle medicine society around the world, we all provide resources for our providers and patients, in our locality. In the Philippines, we recommend resources from the Philippine College of Lifestyle Medicine, the American College of Lifestyle Medicine, the Lifestyle Medicine Education Collaborative. That's where I initially got everything in lifestyle medicine, and the Lifestyle Medicine Global Alliance. And we also have local resources from the Lifestyle Medicine Solutions and Culinary MD in terms of culinary medicine. And of course, I'm so happy that we now have the Global Positive Health Institute, for resources in positive psychology. It was, before it's like searching in YouTube, searching in Google, to find resources, concrete resources, I would say, about positive health and positive psychology. And thank you, Liana, for doing this. And it's not only helpful for providers, and because when we tend to capacitate providers in positive health, then of course patients will be benefited.
Yeah, well, thank you for the plug. And those are all of my favorite resources as well. Thank you so much. So as we wrap up, what is one key message you would like to leave our listeners with? What do you want them to take away?
I believe it's achieving happiness and well-being. That's the most important in all aspects of life. We as providers, and of course our patients, we have a life to experience, we have a life to flourish, a happiness to resonate. So maybe regardless of our social health status, these two things, happiness and well-being, can be achieved by choice, not by chance, and they are incomparably priceless.
Thank you so much for that. So thank you for joining us, Dr. Mechelle Palma, and thank you to our listeners of this GPHI podcast. We'd love to see you on another one of these podcasts. And in the meantime, be safe, be well, be happy. Take care, everyone. Bye-bye.